Introduce myself. I'm Barry Duvall. I'm president of the State Chamber of Commerce, and I'm delighted to be joined here today by so many distinguished Virginians. Before I introduce them, let me just say that we started as a state chamber about 18 to 20 months ago, undergoing a process that we thought was needed in the business community and for the Commonwealth. And that was to put together a blueprint for Virginia that would in fact reflect the business community's goals across the Commonwealth in areas that impacted Virginia's competitiveness. So we invested about 18 months with 600 different organizations, and we had over 7,000 businesses participate in over 30 public hearings around the state. And we put forward the blueprint for Virginia November 20th, which is really a guide for economic development over the next 8 years for public policymakers and private sector leaders in Virginia. We looked at all areas of competitiveness. We highlighted workforce and education. We highlighted energy, as well as other critical areas that impact our competitiveness, including transportation. But we also have a section on healthcare on page 14. And in the section on healthcare on page 14, the Virginia Chamber, joined by over 600 business organizations, articulated the need to reform and expand Medicaid in the Commonwealth of Virginia. And to that end, we are here today to sort of expand upon what we mean by reform and expand Medicaid in the Commonwealth of Virginia. So that is the purpose of gathering here today, is to sort of bring attention to the business case for reforming and expansion. I want to also be clear what we're not here to do today. We're not here today as a business organization or multiple business organizations endorsing the Affordable Care Act, which is a federal law that's in existence. You'll hear about features of that today. You hear about the amount of business taxes that are being paid by businesses in Virginia today and the impact on those. And that was a Washington matter that we at the Commonwealth of Virginia did not have an opportunity to weigh in on through our state representatives or otherwise have an impact on that. However, it is the law of the land at this time, and there is within the Affordable Care Act a feature that allows the states to weigh in on whether or not to expand Medicaid for a specific population. Many states have moved forward with Medicaid expansion. We're not here today to endorse straight Medicaid expansion. I think it's important for those of you who are listening to recognize that the state chamber and the business groups here today are here to talk about reform and expansion. And we're going to do that in just a few minutes and actually get specific with you on the reforms that we would like to see considered as part of the General Assembly process. I do want to recognize that I am here today with Gary Thompson, who will introduce himself more formally. Gary is the chairman of the Chamber of Commerce this year. Gary McCullum with Cox Communication from Hampton Roads and all over the state with his responsibilities, and Kevin Reynolds of Cardinal Bank, and Peter Pruden with Taste Unlimited, who will be speaking to you. I'm also joined today by Chambers of Commerce from across the Commonwealth. Here today with Lori Moran from the Danville, Pennsylvania Chamber, Joe Voludich from the Fairfax Chamber of Commerce, Kim Sheeler is with me from the Greater Richmond Chamber of Commerce. I'm also joined by Brian Stevens today, the president of the Hampton Roads Chamber of Commerce, and Joyce Waugh is here from the Roanoke Chamber of Commerce, president and CEO. Mr. Pond is here from the Asian Chamber, and we also have representatives from the Hispanic Chambers of Commerce. I just think collectively it's important for you to realize that the people who are from chambers up here represent over 30,000 businesses in Virginia, and about 20,000 of those businesses are small business, people that employ less than 250 citizens, but most of them employ less than 20 citizens. So the voice of small business is represented up here today for you in these chambers from across the Commonwealth of Virginia, and I just want to thank each of you all for being here today representing a broad cross-section of business people. And with that, I'm going to pause and ask Gary Thompson, our chair, to step forward to speak a little bit about the business case and the background on this. Gary?
Good morning, and thank you again for being here on behalf of the Chamber of Commerce. And to all of our fellow chamber members from throughout the state, thank you for being here as well. Today is really about the business case for reform and expansion of Medicaid. A few facts that we look at as business leaders. First of all, the Affordable Care Act has created a lot of uncertainty for Virginia businesses. In fact, insurance premiums have increased 32% in excess of the rate of inflation. A tremendous amount of uncertainty exists as to what will continue or not continue related to that. Additional facts is over the next 8 years, Virginia businesses will pay $16.4 billion in taxes related to the Affordable Care Act. Our opportunity and challenge under the provisions of the Affordable Care Act is, can we return $15 billion of that money back to Virginia? In doing so, helping Virginia businesses, helping Virginia communities, and helping Virginia families. The speakers that will follow will help present that case, but Barry now will lay out our 11 tenets of reform.
And I hope that you all have a written copy of this, and if you don't, we can hand it out to you. The press conference has one sentence line items associated with this, but I will spend just a minute on these 11 tenets. And I think it's important to recognize that some of these are in the plan that you've seen from the Senate that's wrapped up in the budget, but others of these go much further. And what we're hoping is that these reforms will be considered by public policymakers to help make this a Virginia plan that will help protect our budget, help maintain the integrity of the budget of the Commonwealth of Virginia, but also at the same time will promote wellness and a healthy workforce. And you'll hear after I go through these from some of our other business leaders. So the first is to move forward with a private option plan that would also include a value-based insurance design. The second is for the Commonwealth to use the savings from the reforms already taking place with the current Medicaid reform, and we commend the work of the Merck Commission and commend the bipartisan approach on those reforms, but we believe there'll be sufficient savings there to help offset the state's contribution to the new population once the federal government reduces its portion of the program. The third is we recognize that these reforms will require waivers far beyond what has been extended in the past because of the extent of this reforms. The fourth is that people who receive these benefits would actively be seeking employment or be employed. I would like to note that currently 70% of the uninsured in Virginia live in families with at least one full-time or part-time worker. So we believe this will in fact benefit those working people in Virginia that are unable to obtain this insurance. The fifth is a market-oriented approach that in fact requires or requests cost sharing by those who are recipients. We're suggesting a potential 5% of the cost to be paid for by those receiving the benefits. The sixth is the utilization of health savings accounts. We think this will help new enrollees to participate and have some ownership of their cost sharing. The seventh is a feature that we believe will maintain the control among the governor and the General Assembly, and that is that this plan be reviewed and renewed and voted on every 4 years by the General Assembly and approved by the governor. And with that, we support the audit of the Medicaid program going forward. The eighth is that the taxpayer should be held harmless and the financial budget of the Commonwealth should be held harmless. Therefore, if there is a failure by the federal government to meet its obligation under this plan, that the Commonwealth of Virginia would not continue to operate the program. The ninth is to request within the new population that emphasis be put on access to primary care and preventative services. We think improving the wellness of the workforce will in fact be a benefit of this program. The 10th is in fact to continue the good work to maintain cost controls through aggressive fraud and abuse prevention measures. And then lastly, that the Secretary of Health would be required to put forward an annual performance review of these specific initiatives. We hope that these 11 guiding reforms will be considered by the leadership in the Senate and leadership in the House, by a majority in the Senate and a majority in the House, and by the governor as having a unique Virginia approach to returning the tax dollars to the Commonwealth, protecting the fiscal budgeting process within the Commonwealth and providing health care to those who need it in a way that will promote health and promote wellness. Now I'd like to ask Gary McCollum to step forward and speak as well. Gary?
Thank you, Barry. I'm Gary McCollum. I'm the Senior Vice President and General Manager with Cox Communications. We are a full-service broadband telecommunications provider here in Virginia. We do business across the state in Roanoke, Northern Virginia, and throughout Hampton Roads. And I am delighted to be here this morning. There are 3 quick points I'd like to make. First, as a large employer, and we have over 2,200 employees throughout the state of Virginia, a healthy workforce is our most important asset. Secondly, the cost of health care and the overall health of Virginia's workforce, that includes our workforce, has become an economic competitiveness issue. And then thirdly, wellness and prevention, those components of the private option will allow more Virginians to make and to take control, rather, and ownership of their overall health care. I'd be remiss if I did not say I'm extremely proud of Barry Duvall and the Chamber and all the chambers around the state for taking a leadership role on this issue. It's a practical business principle approach that in the long run will help all of our businesses and all of our citizens of the Commonwealth. So thank you very much.
Thank you, Gary. And now I'd like to ask Kevin Reynolds, the president of Cardinal Bank, to come forward and introduce himself and his ideas on this matter.
Great. Good morning. I stand before you as a business leader, but also as someone that's lived in the state, and I look at the business case. And for Cardinal Bank, we have nearly 800 employees. We are double taxed. We're taxed at the employee level. We're taxed for the uninsured nearly $1,000. We also have nearly 50,000 account holders at Cardinal Bank. And the uncertainty of health care, of this expansion covering the coverage gap is very important. I'll put it in 2 ways. One is it's about the people, it's about our communities, it's about our customers, and it's about doing the right thing. So we ask the legislatures, both sides of the House, we understand it's a very difficult issue, but all of us that pay our taxes and some of us that overpay, we ask the federal government for refunds. Well, there's $15 billion of refunds that we're seeking. So it's very clear to me, let's do the right thing. We understand it's politically difficult, but the business case is compelling. Thank you very much, and I will echo Gary's remarks about Barry, the Fairfax Chamber, the Hampton Chamber, Danville, and others. Great leadership, and thank you very much.
And now I'd like to ask Peter Pruden to come forward and introduce himself as a small business owner and talk about this issue. Peter.
Thank you, Barry. Good morning. I am here, as Barry said, as a small business owner. I am co-owner of Taste Unlimited in Hampton Roads, and we've been there for 40 years and have seen a lot of things happen. The private option, the principles unveiled today for a private option in Virginia, offers a responsible, sustainable, market-based approach. The principles will allow Virginia to reform Medicaid, control cost, prevent waste, fraud, and abuse, and provide coverage for the working poor. As a business owner, I understand the importance of keeping a house in order financially. This plan, as outlined, will reject the inefficient federally designed Medicaid program and design a cost-effective package option based on Virginia's history of a well-managed state.
I'd like to thank the business leaders that are here and people from across the state. And I think in conclusion, our message here today is we believe the business community is putting forward a constructive set of reforms that we would like public policymakers to consider in this process. We recognize that it is up to public policymakers and those elected to represent Virginians in the General Assembly to make the final review and the final recommendation. But we hope that we recognize these go further than the Senate plan, but we recognize this also addresses some of the concerns related to fiscal management and the exposure within the state budget. We believe that it is a set of reforms that, if adopted, will have to seek federal approval, which, by the way, is no guarantee. And it would, in fact, require a process of approvals probably further than any other state. I've met with 38 other CEOs from across the country, spoken specifically to those in southern states and other states that have received waivers. There is no guarantee that what we've put forward would in fact be approved, but I think if it was approved, we would have some level of assurance that it would protect the financial integrity of the Commonwealth, it would extend the benefits to those who need it, and it would be a way for the citizens to get, and I like the way you put it, get a refund of the almost $16 billion in taxes that are being sent to Washington that could come back to help employers and employees throughout the Commonwealth of Virginia. So with that, I hope you've heard those reform ideas we have. I hope you recognize the distinction between Medicaid expansion and reform and expansion. And I want to thank the people who are up here. And we'll take a couple of questions now if somebody wants to ask one, and then we will break and do some individual questions. Yes.
One of the points on your 11 tenets here is audit, and as I'm sure you know, the DMAS program has undergone a number of audits, dozens over the last 10, 12 years.
Yeah.
And the House Republicans have also asked for a 2-year audit.
Yeah.
I just want to be clear on specifically what kind of audit you're looking for. And do you see this as a rolling audit, or as an audit that needs to come before the state pursues the private option?
Right. Well, thank you, Julie. We recognize the call for the audit over a 2-year period of time, and we endorse the idea of the audit. I would say to you the Commonwealth of Virginia has done audits in other agencies and found important reforms. I think about how many times VDOT was audited and the number of benefits that came from that, but I also think about the ability of the General Assembly members and the governor to come together, find a way to move forward and invest in transportation when in fact it was such a competitive issue and continues to be critical. In this case, I think we're endorsing the audit. We recognize the importance and the benefits that can come from it. At the same time, we're talking about a new plan, a new program. This is really about a program that doesn't exist in Virginia today, and we're talking about principles of reform that we hope can gain agreement in order to move forward with this over the next, in the near term. Again, the timing of this would be up to public policymakers as to when they would be able to come to agreement, Julian, and implement this. But we would endorse that audit that you talked
To
about.
be clear, you're basically saying audit DMAS now, but don't let that be a holdup to the private option moving forward.
Right. I mean, we believe that the principles of reform could be agreed to in the near term. When they go into effect, based upon the steps that would need to be taken from a political process, from the design, from the agreement, from the submission, to the waivers, to ultimately putting systems in place through the private insurance company to manage it, that's going to take some time. Yes, sir.
You say that your plan goes further than the Senate plan. I'm unclear on how. Can you give us the specifics of where your plan differs from the Senate plan?
Right. One obvious example is the requirement to have this voted on every 4 years. We think it's important that this is not a one-time vote, never to be revisited by those public policymakers who represent the citizens of Virginia. We think it's important that the reforms get approved. We think it's important that the implementation and the realization of the reforms that have already been in place, and the Merck Commission and the reforms that have been in place for the existing Medicaid program are going to be realized over the next several years. I think you'll see some in the House actually talk about the need to wait for reform to take place, and part of the reason they want to wait on the expansion is to realize that the reforms already underway will generate savings. So that 4-year window is not magical, but it is a principle that the General Assembly and the governor would get to revisit this issue after the audit has been done, I talked to Julian about, and after the savings from the reforms taking place now are realized. And again, many of us who have been in elected office in the past recognize that government programs are not always and not often exactly the way they are intended. You have to live with them for a while. And so the review every 4 years would give them a chance to revisit it. If it doesn't make economic sense for the budget, if it's not being implemented in a way that is effective, then they can revisit it, provided they have the reforms. Yes, sir.
How much money does the Chamber
I think that's a question that probably gets at more of what is the percentage of representation, and it probably varies from region to region. As many CEOs as you see up here could give you an answer on that in a different way. I would say for the state chamber, about 20 to 25% of our membership is involved in healthcare in some fashion. So that's how I would answer that, and you would have to ask regional chambers about their own. But for us, it's about the same.
And then quick follow-up, how much would you estimate the chamber spent lobbying on the Medicaid expansion issue?
The chamber has spent lobbying on it. I haven't hired any special lobbyists. We're here with our government affairs team that's within our budget. So just the standard government affairs team that we've had. Yes, ma'am.
Could you iterate some of the business taxes that you all are paying under the ACA? And I know there's some for specific industries such as the medical device tax.
Yeah, and I'd have to ask if we have an HR person up here that can do that. I know that we have quantified it through our employer survey, but I can tell you that unless there's somebody want to step forward, we're pretty comfortable. We can actually get you a breakdown of those taxes. We'd be glad to do that. Any other questions about the reforms? Wait a minute, Dave. Yes.
You're here as a united front for the chamber. And then right after this, the speaker is going to have a press conference with NFIB against Medicaid expansion. So what is the public to make of how business feels about this issue?
Well, my message would be that the state chamber is against Medicaid expansion. So I would agree with the NFIB and I would agree with the speaker. But I would say to you, we're here to put forward some reforms that we think make economic sense, that addresses the concerns of public policymakers in the House and the Senate, that in fact protects the fiscal integrity of the Commonwealth's budget. And if these reforms were achieved and approved by the federal government, may very well address some of the concerns expressed by those who follow. I have met with the leadership in the House. I've met with the leadership of the Merck Commission. I've talked about these 11 reforms in advance, and I'm hopeful that they will find them to be acceptable as this process unfolds. But we would agree with them that Medicaid expansion is not the path for Virginia.
But the speaker says, and his office put out a press release today saying that the private option really is nothing more than expansion, because Virginia's Medicare and Medicaid coverage for the non-disabled population now is a managed care product. So
yeah, I think the managed care aspect is a place where Virginia has led over other states. For example, Arkansas, they didn't have the benefit of the managed care approach that Virginia has had for some time. David, did you want to ask me a question?
I did, yes. Among the things that seem to be distinct from the Senate version is talk about a reform to the benefit structure, the benefit of Medicaid.
Yeah.
Did talk about HSA, which is all premium. I'm wondering if you could elaborate a little bit about what benefits to a Medicaid expansion population would look like.
Well, and again, when you get really at the granular level, there are some specific benefits in straight expansion that we think could be reviewed, and a design could be put into place to perhaps lessen the cost associated with managing the programs. And while there are it would take some time to design those plans, but we think redesigning the benefits would reduce the cost of the program as it is extended to those other people.
Would the expansion of the private option have to wait for the redesign to come?
I think it would have to. I think those designs would have to be agreed to, and in fact, it would have to wait to be implemented until those designs were agreed to and those waivers were achieved. So the timing of this is a very sensitive topic. We're optimistic that these broad reforms could be agreed to and that a process could be put into place to hammer out those details.
We're not looking at Medicaid expansion starting on July 1st.
Well, I would leave it to the public policy makers as to how quickly they could agree to these reforms and work with professionals in this field in terms of management as to how quickly they could implement it. Let me do this. Let me close this portion of our press conference and invite those of you to talk to people individually up here. I do want to thank again the business leaders and the chambers for joining us. We look forward to working with leadership in the Senate and the House and our other friends in the business community on how to design reforms that will allow this to go forward to protect the taxpayers of Virginia and the Commonwealth of Virginia while extending these benefits. So thank you for coming.